Hi, this is Abhilasha and this is my final task for the Data Science and Business Analytics internship of the Sparks Foundation. Here we have to create a storyboard showing spread of COVID-19 and identify patterns and possible reasons helping the spread. So here we can see the total deaths and total cases by location, like of Europe, North America, etc. Herein we can see the new cases by location of different places. So if we want to see the total cases per million by month and location. So here we are showing for the world for every month what were the new cases and total number of cases. In this graph for every month we can see what were the number of total cases of COVID-19. Moving on, we can see the total cases and total deaths by continent, and here are pie charts depicting the same. So if we want to see for Asia, so we can see Asia has total cases and total deaths. For North America, for Europe, etc. Asia had the highest number of total cases and Europe had the highest number of total deaths. We can also see the total deaths and total cases by location and by year in the map. So if we zoom in into India, we can see the cases in 2021, in 2020 and 2022. In the same way, you can zoom in into any location and find out the total number of cases for each year as well as total number of deaths. Now if we want to view the total number of cases and deaths by the month, so if we click at May, so we can check the total number of cases and total deaths for each day of the month. Like for November, every single day, or for Feb, across the world. We can also view the new cases and new deaths by the location. So if we want to check for, say, Asia, we can see the new cases here and the new deaths here. Also for North America, etc. in the table. Now if we want to view the total deaths by the continent and the total number of cases and deaths. So here is the table and the map. So if we click at like Asia, we can view all the data. We click at Europe, or we can even click in the pie chart to view the particular places. Now, since hand washing facilities and hygiene are important to prevent the spread of COVID-19, we can see the hand washing facilities and number of deaths as per continents. So continents where the hand washing facilities are less, the number of new cases are higher, as can also be seen in the table. So if we click at Asia, we can see in Africa the hand washing facilities, the new cases and the new deaths. Similarly, North America, South America, etc. at a glance. We can also view the GDP per capita and cardiovascular death rate. As we know, that people who are at higher risk of cardiovascular diseases are also at a higher risk of dying from complications from COVID-19. So in these scatter plots, we can also view the total number of cases per million against GDP per capita. So like if we click at Afghanistan, it will show us the total deaths per million, the cardiovascular death rate, as well as the total cases. Africa, Asia, or any other place. And Uzbekistan had the highest cardiovascular death rate. If you want to view the cardiovascular death rate by location, you can view it here, and total deaths by location are also viewable here. And similarly, it is given in the table. So in case we click at any one place like Afghanistan, we can get the cardiovascular death rate and total death rates. You can check for Egypt, etc. Moving on, so we can see the GDP per capita and the diabetes prevalence by location, as well as the total deaths and the diabetes prevalence by location. So Mexico, the total number of deaths and diabetes prevalence, and Brazil, like that we can see for different countries. If we click at any one country, we can get the diabetes prevalence and total deaths over here as well. Similarly, by clicking here, we can get and this is the summary of the data. Similarly, we can check for the stringency index and the total number of cases. Now, stringency index comprises of travel restrictions, stay-at-home restrictions, and other things. So, countries which have displayed higher stringency index have had less total number of deaths. Like if we click at Asia, we can see that the continent Asia had the highest stringency index and lower number of total deaths. Similarly, clicking here, we can get of different countries the stringency index total deaths highlighted. Moving on, we can also view the Human Development Index of the countries and the hospital beds per thousand of location. So the countries which have higher Human Development Index also have higher number of hospital beds per thousand, like South Korea, Japan, etc. As we move down, countries with lower Human Development Index also display a lower number of hospital beds per thousand. We can also view them by the graph and map. So if we click at India, we get the Human Development Index, the hospital beds per thousand, and the GDP per capita. If we click at South America, North America, so it is available for different locations. You can click here and find the same. So we can view at a glance the total number of hospital beds available in each place on the map. So the conclusions of our analysis has been that nations with lower prevalence of hygiene and hand washing facilities have shown higher rates of COVID-19 as well as more deaths. Presence of underlying cardiovascular diseases in patients with COVID-19 is also associated with high mortality, and people with diabetes have more serious COVID-19 symptoms and they are at a higher risk. Now, stringency index, as shown earlier, is a composite measure based on 9 response indicators, including school closures, workplace closures, cancellation of public events, restrictions of public gathering, closure of public transport, stay at home requirements, public information campaigns, etc. So, countries with higher stringency index have displayed lesser deaths from COVID 19. Hospital beds and medical facilities provided to citizens by government have varied by Human Development Index of nations, and we have seen nations with higher ranking on the Human Development Index list also provide its citizens with better services and more hospital beds. So we have to take the precautions against COVID-19, and I hope you all stay safe. Thank you.